Hi, my name is Owen DeLuca, and this will be my presentation on sleep apnea. So first and foremost, what is sleep apnea? Sleep apnea is a chronic sleeping disorder in which a person's breathing will stop and then restart multiple times throughout the night when they are asleep. Around 22 million Americans, or 1 in every 12 people in the United States, suffer from sleep apnea. The two major types of sleep apnea are obstructive and central. Obstructive sleep apnea occurs when the upper respiratory system becomes blocked or inhibited, which will then reduce airflow into the respiratory organs. Central sleep apnea occurs when the brain does not send the proper signals to those respiratory organs to tell them essentially to breathe. So I'm going to go a bit more into detail about how sleep apnea occurs between the two different types. For obstructive sleep apnea, this is most often caused by the muscles in the back of your throat relaxing. I have a picture in a couple slides that will show this a bit better, but essentially, as the muscles relax in your throat when you are asleep, they can cause the airways in your upper respiratory system to narrow. As they narrow, the less oxygen is able to go through that system, and when the brain recognizes this, it will wake the person up in order to reopen these airways. Now, a person might not become fully awake when this occurs, but this is where the stopping and restarting of breathing happens. The waking up part allows the person to essentially take a deeper breath, cause those airways to open up again. Central sleep apnea, on the other hand, is caused by when the brain either fails or the signal to those respiratory organs to breathe gets disrupted. This is fairly common fix. If those signals do fail or get obstructive, the brain will just send more signals until the respiratory organs eventually get the signal to breathe. Again, though, this can cause the stopping and starting of breathing in the body. So there are many signs and symptoms of sleep apnea. As I mentioned multiple times before, the main one being that episodic stopping and starting of breathing throughout the night when a person is trying to sleep. In addition to that, people with sleep apnea are most oftenly very loud snorers, and throughout the night they will gasp for breath when they are sleeping. That kind of goes back to the whole waking up mechanic, where if a person is gasping enough, they will actually completely wake up throughout the night, where other times a partner might just hear them kind of going like gasping as if like a fish out of water for breath while they sleep. Other signs and symptoms include insomnia and hypersomnia, which are the difficulty of falling asleep at night and the difficulty of staying awake during the day. A bit more niche sign and symptom is dry mouth or headaches, especially when waking up. This occurs because when you can't get the oxygen or the proper airflow going in and out, this can cause the mouth to dry up a lot. And also without proper oxygen going towards the brain, a lot of people wake up with headaches. So some common risk factors that would increase a patient's risk for both obstructive and central sleep apnea include being older than the age of 50, being a male, who are almost twice as likely to get it as compared to females, family genetics, excessive drinking and smoking, or medical conditions such as previously having a stroke, heart failure, or living with hypertension. There are some risk factors that are specifically solely associated with obstructive sleep apnea, and these include obesity, diabetes, or a narrowed airway due to enlarged adenoids or tonsils. As this picture I have up here shows, the enlarged adenoids or tonsils cause that upper respiratory passageway to be restricted and constricted, thus allowing less air to flow through. To double back on some of those other medical conditions, it is very rare that a person with sleep apnea does not have another condition such as obesity, diabetes, hypertension, hypoglycemia, etc. So those are all really important things to consider when it comes to the risk factors of a patient, because some of those risk factors for those diseases might also be present in people with sleep apnea. When it comes to the benefits of exercise on sleep apnea, there are definitely a couple. So right here, this is the picture that I mentioned a couple slides back of on top we have the proper air passageway that you should have when you sleep, and on the bottom we have that restricted air passageway due to those muscles in the throat kind of clamping up on the air path there. So one of the most specific benefits of exercise is the improvement of upper respiratory muscle activation. This can cause an increase in the diameter and reduce the resistance of these air pathways. It can also help prevent pharyngeal collapse, which is muscle contraction during sleep. While we sleep, it is also quite common to have fluid accumulation in the neck. This can kind of cause a thick neck or a thickening of the walls there, which again would reduce that air path. When you exercise, you see a reduction in the abundance of fluid that gets accumulated, thus causing less laryngeal contraction to occur. Exercise can also increase slow-wave sleep, so for people who suffer from insomnia or hypersomnia, it allows them to get more rested and better sleep, thus causing them to not be as tired in the morning. Lastly, exercise can reduce systemic inflammatory responses. People with sleep apnea have elevated levels of proteins in their body, which secrete inflammatory responses, thus again closing those air passageways, which can cause to sleepiness, fatigue, and other cardiovascular complications. Exercise helps prevent the amount of these proteins secreted, thus less blockage. So for the effects on exercise specifically, those with sleep apnea have a significantly reduced peak VO2 max, on average by 14%, from this one study that I have the image of right here. In the study with people who were the control group, their VO2 max, their average was around 82, where the people with moderate to severe obstructive sleep apnea was around 68. So in addition to this also means that people with sleep apnea have a reduced ventilatory threshold, ventilatory efficiency, and respiratory exchange rate or ratio. What this means is that those with sleep apnea have a significantly decreased aerobic exercise capacity, and I'll get into why that matters a little while later when I get into the specific recommendations of what you can do about that. In addition to this, it's not necessarily proven that these things are due to sleep apnea, but issues such as systolic and diastolic blood pressure drops, heart rate, and decreased oxygen pulse may also occur, though, as I mentioned before, those might actually be more indicative of other diseases associated with people with sleep apnea rather than the sleep apnea itself. So when it comes to treatments and medications, there's not really much you can do while you're awake. One of the most common things that people have with sleep apnea is a CPA, AP, or a CPAP machine. This stands for continuous positive airway pressure. You can also get other oral applications, so like things that go over your nose that kind of expand, or mouth that kind of expand those airwaves. Other devices that, and all essentially that these things are doing, are helping a person open up those airways and is constantly perfusing air into their body so that they don't ever get to the point where they are lacking of oxygen or air. There are surgery treatment options, which usually revolve around removing or shrinking tissue, such as the one that can become like inflamed in the throat, repositioning the jaw, which I found very interesting, because so what they actually do is you can reposition the jaw to give yourself more space in kind of the larynx and diaphragm in that kind of area, or completely creating a new respiratory passageway. That's usually what happens when people have absolutely horrible sleep apnea that is almost uncontrollable. There are some medications being developed currently that can help prevent airway collapse or increase respiration, but as of right now, they're not really that common. So for my case study, my patient's name is Mike Jones. He is a 57-year-old man who's been diagnosed with sleep apnea since he was in his mid-40s. He uses a CPAP machine, as most people do when he goes to bed, but he hasn't done much to combat his issue. Lately, Mike has been feeling more lethargic than ever. A friend of his who also had sleep apnea mentioned to Mike that he started a new exercise program and has felt reinvigorated. Mike, also wanting to feel like he needs more energy, like I said, he's feeling lethargic, he's not getting enough sleep, he's not feeling too great, wants to or hopes that with an exercise program he'll be able to become reinvigorated, have more energy, and even lose a couple pounds. Mike is 5'10" and 225 pounds, which classifies him as obese, a common thing usually associated with sleep apnea. He has type 2 diabetes, another somewhat common factor, with a resting blood glucose level of 232 milligrams that he manages with glucodrol XL. His resting blood pressure is 128/84. He currently does not exercise regularly, and his only physical activity is a slow walk around the block, which he does with his dog every morning. Mike does not smoke and only occasionally drinks. It was recommended that he get medically cleared before exercise testing occurred. So when it comes to exercise testing itself, I would recommend for an aerobic test the 6-minute walk test. This is a non-invasive test suited for people who typically are not too exercise oriented. It's relatively simple. It's a similar method to what he already does, which is walking his dog, and it can also be used to calculate his percentage of heart rate reserve for the exercise prescription. For resistance testing, I would like him to do a 5 RM squat and bench press test. So we're doing this 5 RM since the patient is not that used to exercise, so we don't want to do a max test. You also don't want to do a max test almost at all with a person with sleep apnea, with all the respiratory and potentially cardiovascular issues that could occur. These tests will also include both upper and lower body, which I think would be very good because we want to make sure that we can hit all the ranges when we do or all the body parts when we do his exercise resistance prescription. And by using an RM kind of method, we can calculate a percentage of 1 RM that we can put into his exercise prescription. Flexibility, we'll have him do the Apnea scratch test and the 90-90 straight leg test. Again, these are relatively simple tests that a patient doing them for the first time should be able to perform, and they include both upper and lower body flexibility, which will be important. So for the exercise prescription itself, I want to make it really clear that by far the aerobic prescription is the most important, since a lot of the effects on exercise has to do with cardiovascular issues. The aerobic prescription would by far do the most to help relieve and increase the ability of the patient. So for our patient Mike, starting him off with walking, since that's something he kind of already does, and hopefully graduate to jogging. Starting off at 3 days a week, but hopefully build up to 5. Start at 50 minutes a day, but hopefully build up to 30 to 45. Start off at 55% of his heart rate reserve, which we can get from that 6-minute walk test, and then build up to 70 to 85%, and include a warm-up and cool-down there to make sure that he's all right. For the resistance prescription, upper and lower body free weight training, 2 to 3 days a week on non-consecutive days, 10 exercises, 2 to 3 sets per exercise, 8 to 12 reps, depending on if we're going a bit more for endurance or a bit more for muscular strength. We're going to start out at 45% of his 1 RM since he really doesn't do almost any resistance training right now, but hopefully we can build it up to 60 to 75%. Again, we can get that 1 RM from the 5 RM squat and bench press that we did. For flexibility, I want him doing static and dynamic stretches, 5 for his upper body, 5 for his lower body, hopefully around 2 to 3 days per week at the minimum, if not more. And I'm going to have him hold for 30 to 60 seconds to the point of slight tension. So when it comes to modifications and special recommendations for people with sleep apnea, there aren't a lot that are specific to sleep apnea itself, and I'll explain that. So one of the things that is specific to them is that no matter what any other conditions that a person might have, people with sleep apnea do typically have reduced VO2 max and are more prone to asthma. As I show by this picture here, asthma, restriction of airways causes people to have a hard time breathing. It is recommended then that when exercise does occur, especially aerobic exercise, it occurs in short bouts rather than one long continuous exercise. So for resistance training, that really doesn't have to be the problem because you're not doing things often for elongated periods. It's not like you're for 10 minutes lifting weights straight, you taking those breaks. But for an aerobic exercise, it might be important to break down that 30 to 45 minutes into smaller 10-minute sections with some time in between. As I mentioned before, people with sleep apnea often have other health conditions. So the main modifications and special recommendations that a person should take are to look at whatever that specific case is and then apply that to the person with sleep apnea during their exercise. In Mike's case, he takes Glucodrol XL for his hypoglycemia, therefore he is more at risk to become hypotensive during exercise. To recap, sleep apnea is a chronic sleeping disease that restricts airflow into the respiratory system when a person is sleeping. There are many signs and symptoms such as excessive snoring, episodic breathing while asleep, and lack of well-rested sleep. Many people who suffer from sleep apnea also are likely to suffer from other diseases such as high blood pressure, hypoglycemia, diabetes, and obesity. Sleep apnea mainly benefits from exercise by improving upper respiratory muscle activation and reducing inflammatory responses. During exercise, it can have a negative effect on respiratory rate and peak VO2 max levels, which is why it is important to take breaks periodically. Exercise tests should be done at a low to moderate intensity of 30 to 50 heart rate reserve, while exercise prescription should mainly focus on aerobic activities at 55 to 75% heart rate reserve. And these are my sources at the end.